Hello, everyone. My name is Demeshia Jordan Williams. I am the founder of FreeMe Incorporated nonprofit, where we provide group support, awareness, and resources for women and their families that are dealing postpartum or just life. Tonight, we have our community Zoom community workshop with Dr. Taska Moore. She is an OG BYN doctor, and she is the founder of Healthy Bump Club. So I will let her introduce herself. Our topic tonight is prenatal mental health. Take it away.
Love it. Thank you so much, Jordan. I truly appreciate you having me on your platform. And congratulations with all of the work that you're doing and the difference that you're making in our community. You and I agree wholeheartedly that this is an important topic for our community in particular. Hi to everyone. I am Dr. Taska Moore, and I am the founder of Healthy Bump Club, a platform where we do pretty much like this. We bring on professionals, experts in a diversity of fields that have some input on motherhood, maternal health, to basically talk about topics that are important to our community from our perspective. So the majority of our professionals are women of color. And that was important to me as a foundational purpose for the platform. So I'm so excited to be here today to talk about perinatal mental health. It is such an important topic because I will explain in a little bit just how much it's not just about the pregnancy, it's about the long-term health of mom. We want to make sure that our moms not only have healthy pregnancies, although that is a serious focus and needs to be because we are in a crisis when it comes to Black maternal health. But also, we want to do more than that. We don't want moms just to have a good pregnancy. We want them to have an enjoyable pregnancy, a great experience, and then to also have a great motherhood. And in order for our moms to have a great motherhood, we have to optimize their health even during pregnancy and continue to empower them to be great moms afterwards. So, postpartum depression is usually what most people think about when we talk about mental health in regards to pregnancy. But mental health conditions are far more than that. We talk about postpartum depression, but there's also perinatal depression. Perinatal depression just emphasizes and highlights the point that depression and mood disorders, so not just depression, but depression and anxiety, can happen at any point during the pregnancy, even before the pregnancy, for our moms who are going through infertility, perhaps, or fertility treatment. That can be associated with lots of depression and anxiety disorders for the obvious reasons, right? It's a very tough and difficult course. Then you have baby blues. And some people have heard about baby blues and some people may not have. And oftentimes, baby blues and postpartum depression get a little bit confused. And that's because they have very similar symptoms, but they are not the same. So, baby blues are moms who immediately after birth, usually within the first couple of days, will start to experience periods of crying, sadness, mood changes, mood swings, and just exhaustion, right? As you can imagine, having a newborn, having gone through childbirth, is very taxing on the body and it's equally taxing on the mind. So with all of the hormonal changes that happens immediately in the postpartum period, it is not unusual to have a swing of emotions during that time period. Postpartum depression is a lot more severe than that. The symptoms last longer, whereas baby blues will resolve typically in the first 1 to 2 weeks. Postpartum depression, typically for most women, will start somewhere around 3 to 4 months, and will start somewhere around a couple of weeks after the childbirth and then last for about 3 to 4 months. But it's important to know that these symptoms can occur at any point during the postpartum period, which is up to a year. And I would say even beyond that, especially if there wasn't early intervention in the beginning, a lot of times because these symptoms may not necessarily start immediately in the postpartum period. There is oftentimes a delay in recognizing the symptoms because, 3, 4 months out, 5 months out, you're not really thinking about your childbirth experience still having some impact on your mental health, but it absolutely can. And we want to make sure that our postpartum moms especially are aware of that, because we know that the far majority of our maternal mortality outcomes happen actually in the postpartum period. And one of the top causes of maternal mortality is mental health related issues. So it's very important, and I'm thankful that this platform, FreeMe Incorporated, is prioritizing having this particular discussion. So one of the things you want to know, one of the things I do in my practice is if I have someone who have a mental health disorder, and I know that they are at risk. Perhaps they've had postpartum depression before or perinatal symptoms before. We want to do what's called a mental health plan. And that is similar as if, let's say, you were diagnosed with prediabetes, right? You don't just sit back and wait for diabetes to happen. You usually have a plan and hopefully plan your preventive methods with your clinician. Same thing with mental health. And we have to focus on mental health as being very similar. If I'm at risk for something, if I'm at risk for heart disease, then I want to do the things that are going to minimize my chances of developing heart disease. Same thing with postpartum depression and perinatal mood changes. Is if you know that you are at risk, then you may want to have some type of plan or intervention to decrease the likelihood that you're going to develop those symptoms. Now, there is no cure, and I'm not going to deceive you into think that any one of the things I'm talking about today are a cure or 100% prophylaxis when it comes to mood disorders. But certainly you can decrease the severity, decrease the duration of the symptoms, and in some cases, even avoid the onset of postpartum symptoms. I definitely have witnessed women who have had postpartum symptoms in a prior pregnancy and didn't have postpartum symptoms in a subsequent pregnancy. I don't know if you guys heard Cardi B's experience, but she said that one of the things that helped her was that she focused on caring for herself. And when she had perinatal symptoms in her prior pregnancy, she didn't have in her subsequent pregnancy. So there are things that we can do, and that's empowering to know. One of the things I do want to highlight before we continue is the fact that oftentimes, we don't want to confuse psychiatric disorders and perinatal disorders. They're not the same. So, when I'm talking about psychiatric disorders, I'm talking about the patients who are affected by bipolar disorder, schizophrenia, those who have affective disorders or personality disorders, psychosis, things like that. When I'm talking about perinatal mood disorders, we're talking specifically about your mood. My mood can be depressed or my mood can be anxious. So we're talking about anxiety and depression symptoms specifically. So we know that there are certain things that increases a mom's likelihood of developing mood disorders. We know certainly having a prior history, a family history also. So it's important for us to have those Thanksgiving dinner conversations and find out what our family history is. Also, those who are affected by poverty, those who have low income, women who have a poor support, right? So if I don't have a lot of people to support me, it's more likely I'm going to experience these disorders. If I have a relationship issues, if I have financial issues, if I have difficulties or a difficult childbirth experience or an unexpected outcome with my pregnancy, perhaps I had a traumatic experience even, those are more likely to increase your likelihood of developing mood disorders. And also the child. So if I have a child that may be in the NICU, a child that has an unexpected outcome at birth, a child that has a high need for health care, meaning a child that may be fussy or colicky, I'm also more likely to experience mood disorders. So when patients experience mood disorders, there are some typical symptoms we think about, right? We think about symptoms like feeling sad, like sort of your typical expectation if you're talking about someone who has perhaps postpartum depression specifically. So I may feel depressed mood. I may have low energy. I may not be sleeping very well. I may not be interacting with my family a lot. those are sort of the, I may be crying more often, right? Those are sort of the typical symptoms when we talk about postpartum depression. But there are also symptoms we don't really talk as much about. So rage is a very important symptom to know. And it's also one of those symptoms that women are hesitant to share because they feel some guilt with regards to their rage. So rage is an important symptom to know. Irritability is also important to know, especially in women of color. Sometimes our depression doesn't look like the classic signs of depression. We may have a short fuse, and oftentimes that gets stereotyped, right? And that's because people don't understand that irritability and having a short fuse may actually be a symptom of a mood disorder. Patients may become more isolated, may have some anxiety symptoms. So we don't talk as much as of postpartum anxiety, but that too is very commonly experienced by women. Postpartum anxiety can look like I don't want to go out the house. I have fear of going out of the house. I don't want to interact with people. And there may be some level of normalcy with a little bit of anxiety postpartum when it comes to taking care of a child. So, all of you who may be checking 2 and 3 times to make sure the child is breathing, you're okay. That's not a symptom that you're anxious. Where it becomes anxiety disorder is when it's really interfering with your ability to do your daily activities, to take care of yourself, to take care of your child. Your concentration may be off. Your ability to focus may be off. You may be so confused, right? Those are symptoms where it's a little bit more than just your typical motherhood anxiety, right? Patients oftentimes will also have symptoms where they don't want anyone else to hold the baby. So if you're finding that you don't even trust your loved ones with holding the baby, that could be a sign that you may be having some difficulty with a mood disorder. And then the opposite, patients who have, or women who may experience having bonding issue. And this is something that a lot of women don't talk about because again, there's a level of guilt that comes with this particular symptom. So not bonding with your child, feeling disconnected from your child. Some women even feel disassociated, like they're kind of watching themselves outside of their bodies, having an out of body experience can be a more severe sign of postpartum depression. And of course, where postpartum depression is as common as 1 in 8 individuals to 1 in 10 women, then we have a severe form of mood disorder called postpartum psychosis. So, postpartum psychosis are your women who really have severe symptoms where they may be hallucinating, they may be hearing voices, they may be having lots of intrusive thoughts, thoughts that may even cause them to think about having ideations. And I know on certain platforms, we can't say certain words, but we'll say self-harming ideation so they don't flag us. There are women who have that severe symptoms, and that ideation can be both self-harm and harm to others, including their child. And that's a symptom that's very difficult for a lot of women to share because, especially in the Black and Brown communities and our people of color, expressing those symptoms can lead to some anxiety about the system and the chances of the system then taking our kids away. And so a lot of times it's really hard for individuals to share those types of symptoms. But this is why it's really important to have a healthcare provider that you're comfortable with because it's in your safety and best interest that you are able to express those types of symptoms because those types of symptoms are really where some of the mortality comes up. And patients who have postpartum depression, most can be managed in an outpatient setting. A lot of your postpartum psychosis patients will require some hospitalization. And that can require some type of planning with the family to ensure that the newborn is taken care of. There are sometimes difficulty with breastfeeding. So breastfeeding can be one or two things, improve mood disorder, or it can actually make it worse. Unfortunately, because of a lot of the pressures we have in society for women to breastfeed and a lot of the guilt that comes with not breastfeeding, when you're already experiencing a mood disorder, you can feel so pressured to breastfeed that it actually worsens your mental health disorder. Whereas the opposite can happen in other women. Other women can feel that the biochemical response to breastfeeding, that connection with her child, that bonding with her child, that release of oxytocin that helps them to connect together as mother and child can actually be beneficial to her mood disorder. So for those who are experiencing mood disorders, you don't have to feel like you need to fit into one category or the other. If breastfeeding is making it worse for you, it is okay to say that you cannot breastfeed. No different than someone who may have a medical condition that may be on medications that can't breastfeed, right? And so it is okay to say that your mood disorder is being triggered or is becoming worse by breastfeeding. And similarly, for some women, it may be imperative to continue to breastfeed because it is helping your mood in your mood disorder. When we talk about I want to focus a little bit on Black women. So, whereas the general public may have a rate of anywhere from 1 to 8 individuals to 1 to 10 individuals may have postpartum depression symptoms, Black women are disproportionately affected by postpartum mood disorders and disproportionately do not have access to help. And there are a number of reasons why that is the case. So, our rate or prevalence is somewhere between 29 to 44%. So that means nearly half of women, of Black women who become moms, will experience some type of postpartum mood disorders. So that means that we need to do things like what we're doing now, getting the word out, getting have increasing access to help and doing all the things that we know are able to decrease the likelihood of these outcomes. So I talked about, so one of the reasons why our prevalence is so much higher has to do with the experience of racism in America. So experiencing racism, daily trauma, daily exposure to stress, chronic stress issues, of course, will increase the likelihood that you will experience postpartum mood disorders. I didn't touch on single motherhood, but single motherhood is also a factor, right? So if one of the risk factors of developing mood disorder is the fact that you may not have adequate support, you can imagine that a single mom may have less support than a mom who may be in a relationship, right? And so single motherhood is higher in our community because unfortunately our Black men are funneled into the prison system. They are also not surviving through their adulthood, and for other reasons that we can trace back to racism or acism, because you know these platforms be platforming. Unfortunately, because of a lot of systemic issues, there are a lower number of dads or Black fathers that are in the home. However, that is not to be confused with Black dads not wanting to be fathers. And that is important to make clear. Black dads do want to be fathers. In fact, they enjoy fatherhood. And a study was done that showed that they are the most out of all the races involved in the day-to-day activity of their children. It is for other reasons why they're not in the home. But as a result of that, leaves our moms to care for newborns oftentimes on their own as single moms. And so it's important that one, we identify our single moms who are Black because we know that not only is her single motherhood a risk factor, but also her Black experience in America a risk factor, and make sure we maximize the support for her. Make sure we talk about it takes a village. Now it's time for us to be that village, right? Because a lot of times when these topics come up, when people are no longer pregnant or have finished their childbearing, or perhaps didn't want to be a mom, it's important that we all pay attention and we must address these topics from a community perspective. Like I'm actively listening to this topic because even though I'm not the mom, I plan to be part of the community that supports the mom. And so our mindset has to be a little bit different. And instead of tuning out to topics that aren't directly speaking to us, to tune in to see how being a part of a community can help another person. It's also important to what I do oftentimes as well is for the dads who are in the home to make them actively part of the postpartum experience. So we start planning who's going to be home with you, especially if I know a mom is going to be at risk. We start planning who's going to stay with you and how long are they available to stay with you, right? And we want to make sure that dads get their paternity leave and that paternity leave is maximized. And it's important, moms, that you lean into his help, right? So if he's home in the household, listen, if you are breastfeeding, feed that baby and pass that baby, right? Because your body is still healing, your emotions are still shifting, your hormones are going up and down, you're physically exhausted from childbirth. So it's important that when dads are in the home, that they are allowed to be an active part of rearing that newborn and allowing you to rest. It is important to rest. Rest is so important, not just for the physical body, but also important for the mind. And so, one of the things I do is we try to maximize the rest that she can get. So, let's say your partner doesn't have paternity leave, right? Two things to know if he doesn't have paternity leave, and I really think that you are at high risk or you're already showing signs of having mood disorders, then we may actually request FMLA, right? FMLA so that he can take time off to help take care of you and the baby. And that's something that you can plan in advance, right? Or two, we bring in reinforcements. Who are the other family members that are around? And not family members who are coming to cuckoo kiki with the baby, right? That's cute and all, but we want the workers in the family. We want the people who are ready to roll up the sleeves, can wash some dishes. They may not be able to do everything, but if someone can stop by and wash the dishes, will do the laundry for you, then utilize them. I would say for our baby showers, in addition to the gifts, perhaps coupons, right? So have family members give us coupons. So what are you willing to do and help as a part of this village? You don't just get to take pictures with the newborn. You gotta work for those pictures, right? We gotta make sure that we have as much help as we can, especially in that critical time period, in that first 4 weeks. And I know a lot of traditional societies, you will learn whether it's the quarantina or whatever it's called in our community, in our traditional communities, that first month, they knew what they were talking about. They knew what they were doing. That is the most critical time period in the postpartum experience. The other thing that you may want to consider is if someone asks you, what do you want me to gift you for the newborn? Perhaps you may not be available because you live across the country, but you may be able to pay for services, right? You may be able to pay for cleaning services for me for a month. You may be able to pay for someone to come and drop off some meals for me for a month, right? So there are so many ways as a community we can be active part of the recovery period of a mom, or recovery period of a couple who have just given birth and brought life into this world. Now, one of my favorite support systems are doulas. We are so underutilizing doulas, and there are some individuals that will say, I don't really need a doula in the childbirth. This is my fourth or fifth kid. I got the childbirth, right? Or I may not necessarily need the services in my pregnancy. Fine. But postpartum, you may really want to utilize that doula services. I mean, why not? We know that doulas being involved in our care increase the wellness that we have. It decreases complications. We know in certain communities, including in the childbirth, we have less intervention, less C-sections. Moms are happier, more content with their experience. Pain management is better. It's a win-win. It's an absolute win-win. And I do have some moms sometimes that are a little hesitant to have a stranger in their home. I get it. I understand that. If you are hesitant to have a stranger in your home, then perhaps you may have a family member or loved one who may want to do the training to specifically be your doula, right? And so sometimes even dads go through the training process of so that they have better understanding and better perspective and resources to be able to help their partner. And so those are some of my favorite ways of really working to plan so that we are less likely to encounter some of these conditions. One of the things that women ask all the time is when can I be active again in terms of being physically active? And I would definitely tell you that being physically active is beneficial as well. So if you want to call up your clinician, especially if you had a vaginal birth and you feel great in your body and you want to go for a walk, getting outdoors and connecting with that sun, you guys, it is absolutely healing. And so, one of the things we learned from the postpartum, and I'm sorry, one of the things we learned from the pandemic is the fact that being in the house for a while will get to anybody. Now, think about the moms that are home in the house for weeks, just them and a crying baby. It is a lot, a lot. So, even dads, if you're working dad and you get home, give her a good hour. Let her go outside and get some fresh air. Let her take in that oxygen, that fresh air outside. Let that sun hit her skin so that she feels like there is a break between morning and day, and I just don't feel like the days are fused together. I don't even know if it's morning. I don't even know if it's nighttime. So it's really important to step outside, go for a walk if you can, go to a beach if you're in that type of community, go and connect with nature. We know that nature is healing. We know this. We know that connecting with nature is healing for the obvious reasons, right? The obvious reasons. And so, if you are having some symptoms, you can step outside, go to the water if you're a water person, go to the land and connect with some trees, walk through some garden, walk through a forest, take a stroll in some place that is not just brick city, but is actually nature, because that in of itself is very healing. The other thing I just want to add a caveat to being indoors. So we know that people of color, our beautiful melanin skin is highly protective, right? So it protects us from the sun. And that being said, we're more likely to have vitamin D deficiencies. So nutritional deficiencies are also something that should be evaluated, and we shouldn't just assume that someone is truly depressed until we did a full evaluation, because oftentimes, again, when you're indoors as a new mom, you're not getting exposed to sun, you may not even be eating that well. Making sure that your vitamin D level isn't low, because as much as it's connected to a lot of other things, we talked about fibroids, we talked about the immune system with the pandemic, also your energy level. So if your vitamin D level is low, your energy is going to be very low. And so you may be having low energy and it's not really depression. It could actually be a nutritional deficiency. Similarly, you can be having low energy, feeling kind of groggy, and it could be your thyroid. So you want to make sure that your thyroid is also functioning well. We know that women are significantly more likely to have thyroid disorders, especially autoimmune conditions, especially around the time of pregnancy and the postpartum period, because there's so many shifts and changes taking place. So you may want to make sure that it's not your thyroid, especially if you don't feel like you're depressed, but you still feel like you're exhibiting some of the symptoms. Your weight may be shifting, your energy may be low, you may be sleeping a lot, more fatigue. That those symptoms cross over and are very similar to thyroid dysfunction symptoms as well. So the other thing I wanted to make sure that we're aware of are some of the resources that are out there. So I talked about doula services. Make sure y'all get yourself a doula. Don't let that resource go by. Tap into that resources. It's doulas are amazing. Also, there are different organizations that have been doing this work for a long time. So for example, the Postpartum Support International, they are an amazing organization, and they have been in this space for a long time, have a lot of support groups of diverse subgroups, right? So they have the new mom support group, they have the mom with a toddler. Okay, we didn't talk about that, but the spacing of pregnancies, having a toddler and a newborn, I have heard probably almost unanimously for the women who've had that experience, it is one of the hardest experience ever to have a toddler and a newborn. So they do have a women who have a toddler group. They also have support services for dads. So, one of the things we also want to keep in mind, we want our dads to be healthy. We want our dads to be able to understand and empathize with postpartum symptoms. It's hard when you've never experienced it to know what it's like. And so it just seems like, oh, it's just in her head. But it's not. It is actually a physiological condition that's exhibiting as a mental condition. And so it's important if a dad may be having a hard time really understanding, or perhaps rage is her symptom, or irritability is her symptom, and then start to take things personally, like, oh my gosh, she's always yelling at me, she's always going off the handle. It's really important that you also have support in order to be able to best support her. And so tapping into a lot of those organizations, I know that AIM has a dad's group also for our Black fathers. So you want to look them up as well. And then also Maternal Mental Health Now is also a resource that you can go to be able to have support. So why is it important to treat postpartum symptoms, anxiety or depression? One, untreated, there are consequences to untreated symptoms, right? Symptoms can be as severe, and I'm giving you real examples, as severe as not no longer wanting to go outside, no longer having panic attacks whenever you want to need to drive somewhere, not able to go to work anymore because your symptoms are so severe. It can cause marital issues, it can cause relational issues. And one of the things that we don't talk about as much is the siblings. Right? So, a young child who all of a sudden a newborn arrives, especially if it's a toddler, and now mom is no longer the same. She's not talking to me. She's not talking to anyone. She doesn't interact with me as much. Siblings, young kids who don't have the ability to process that complexity can have a wide range of symptoms. And it can go from them experiencing rage also to them disconnecting from mom and feeling like sometimes rage can be their symptoms too. When you see those toddlers throwing things and hitting the newborn, right? That means we got to address what the toddler is experiencing, because those early years, as we've learned from Dr. Black on our platform, she's taught us well, she's schooled us that those early years are so critical in terms of how we develop our emotional health, how we trust, how we create bonding. And so, if there is an experience like that that's happening early, that can lead to dysfunction among siblings. You ever wonder why siblings, when they grow older, they don't get along? A lot of these things are starting very, very early in infancy, in toddlerhood, and you want to be able to address those time periods. One of the things that I have tried with some of my women is having even if it's 5 or 10 minutes, having 5 or 10 minutes with one-on-one with that other child that's having a hard time adjusting, right? So that they feel like they're seen, they have their personal special time. You can call it whatever you want to call it. We can do rainbows, we can do butterflies, we can draw, we can build Legos, whatever you want to do. But that child can feel like they are still a very active part of the family. And also having conversations with in terms of, and also one of the things that we want to talk about is the system, right? So a lot of times women hesitate to bring these symptoms up because they feel like the system is going to come get them or may come and start and open a case with CPS. And it's important to know that your mood disorder, your mental health should never be the reason why CPS case is opened. And again, part of that starts with having a healthcare group that you trust. Because if you don't really know your healthcare group, you don't really trust them, you don't know who's going to call. Medical kidnapping is a real situation. I try not to say trigger words, but medical kid, okay, napping, right, is a real thing in our community. It is a very real fear. And so I understand why a lot of our women feel that way. But part of preventing those issues from happening is taking the initiative to interview your clinician, understand who's taking care of you, who's part of your healthcare team, and you want to feel like you can trust them to share those types of symptoms. CPS should never be a part of someone's mental health condition. because it's no difference than having a physical condition. So I want to reassure you that no clinician should be opening up a case simply because you are depressed or simply because you have anxiety symptoms, no matter how severe they are. The other, I was gonna say something else about the system, but it just flew out of my brain. So I will try to get back to that in a second. It happens, it happens. But understanding that there are ways that we can, as people of color, create community to become the village for women. Even before their postpartum. Postpartum, I feel like is such a late time period to set up a safety plan, but starting at the very beginning of the pregnancy, who's going to be a part of my village? Who's going to be there to support me? Who can come and help me, right? And then also talking about utilizing your therapist. So sometimes I say therapy is not only just for when you actually have the symptoms. So sometimes we start therapy knowing that you are at risk or prophylactically doing therapy so that we can address, for example, triggers. Perhaps you have a triggering experience in your prior pregnancy that may be coming up, or your concern may come up in this pregnancy. Let's start therapy early. If you have some concern that you figure may be a risk factor for you moving forward. So get the therapist in, um, and continue to undergo therapeutic check-ins throughout the pregnancy, and then continue your therapy postpartum. Because it's one thing that we know is the stress of postpartum, the demands of postpartum, significantly can increase the likelihood that the symptoms are going to show up in that postpartum time period. The other thing that the other thing that it's important to know are medications. So a lot of our women do not like to take medication, especially because we can't guarantee not a single medication is not going to come into breast milk, right? So the minute you hear that, you're like, oh, nope, not my child. But the truth of the matter is, a lot of these medications have been studied. There are safe medications you can take. If you are in need of the medication, it's important to take it because untreated postpartum issues have long-term outcomes. I think they even have a cardiovascular outcome was one of the recent things I read. So it's more than just your mood. Your mood affects your overall health and it affects you relationally. So if you have concerns about medication, look into it. Look into it even in the beginning if you think that you may be at risk for having the symptoms postpartum. Start having those discussions early when you're not exhausted, when you're not stressed out, and really start to think whether or not if you were to have severe enough symptoms, you would want to undergo that type of treatment. The best outcome, especially in severe cases, is a combination of therapy and medication. There is a newer medication, Zurzuvae, that's on the market that's specifically for postpartum symptoms that isn't that's a 2-week duration of taking the medication. So it's not like your typical antidepressants like your Zoloft, your Cymbalta, where you have to wait for weeks before you even start to see the improvement in your symptoms. So that medication is an option if you're not interested in taking some of the more traditional antidepressant medications. The other thing that's important to know is the course of how you're going to recover. Not everyone recovers trajectory like this, right? Oftentimes we think, oh, we take a medication, we start therapy, we should be going in this direction. And that's not the case a lot. Oftentimes, some women, when you have good days, and then you have not so good days, and good days, and you have not so good days. Eventually, it will go up and down, but ultimately, your symptoms will start to recover. The far majority of women will recover in the first few months after having the child. So that's also important for you to know. That being said, hope I didn't, did I run long?
No, you're good. You're
I'm
good.
good. Okay. Because I could see clearly I could talk about this
Oh
topic.
no, this is all great information. I'm writing notes, my own little side notes. So no, you're doing great.
I could talk about this topic forever. It's such a very important topic for us. And I'm so happy that we're prioritizing talking about this topic and really dispelling some of the myths, and hopefully empowering women to not just know that they can be treated and know that it's okay to share these symptoms, but also that they can be proactive about their symptoms. And that's really the message I want to get across, is to make sure that women know that you can be proactive. If you truly know that you're at risk, you've had it before, then start to plan, as well as you plan other parts of your pregnancy, plan a way that you can minimize the likelihood of having some of these symptoms. And I forgot to mention for our working dads, because sometimes that's the issue. Dad is working, mom is home with all the kids. Even a working dad, when they come home, take over, give her a break. And if you're a dad that have the weekend off, you don't really have the weekend off when you have a newborn, right? So it's important to give mom at least one of those days. You get 2 days off. No, that's 2 days off for you and her, right? Which means a variety of things, right? I have couples that one person get their Saturday, the other person gets the Sunday to themselves. I have other couples that will say, okay, I can't do a whole day, but we can do half days. I take the morning shift, you rest. I'll take the evening shift. I get whatever else we got to get done. So that's an important method that you can use if you are a working dad. When you come home, give her a break so that when it's time to rest, you get your night sleep and she'll take the night shift. But give her a break so that she can go and rest, take a shower, do very basic things. Maybe even go get her nails done. It's very important to connect with who you are, because motherhood, you can lose who you are. Your identity is so very easy. It's important for her to continue to be able to do things where she feels that, okay, this is me again. Like, I can identify with who I am. So just some other tips on how to manage if you have two, working individuals. Mom is working at home and dad is working outside the home. The other thing, I almost forgot this. The job. So a lot of women, especially if they have had prenatal complications and had to leave work early, they stress a lot about the job situation. First of all, your job is not supposed to call you. There are some jobs out there that still call. I know who you are, right? You're not supposed to be calling her. I don't care what position she is in the company. She's at home, and important. If you really want her to come back, do not, and I'm saying this for all my business owners out there, if you really want her to come back, you want her to be well. If you are calling her, she's not going to be well. You're not giving her time to recover. It's important for moms to know they are protected class. Pregnant women are a protected class. So, utilizing the laws to protect you if you feel you have a job that's very intrusive. It's very important to know what your rights are. And there are some differences by states, but for the most part, you are protected class. And so your job should not be pressuring you to come back. Similarly, if your doctor has deemed that you're not ready to come back, your doctor, your therapist, whomever, have deemed that, you know what, her mental health is still severe enough that she cannot return to work, then it's okay not to return to work. I don't care if the sky is falling for the company or for your job. It doesn't matter, because what will happen if you return to work before you're well, just like anything else? If you had a wound infection, would you return to work with a wound infection? No, because you know it'll probably get worse, right? And the same thing with your mental health. If you return to work when you're not ready, you can then worsen your symptoms, right? Because the stress of work can amplify your symptoms. On the flip side, I do have some women who say that going to work helps them, because the distraction of work helps them to kind of reset in a way. So again, not everyone is, this is not one size fit all. Everyone is going to have a different path. The other part, when you're dealing with perinatal symptoms and you will have to make some changes in your job hours in order to deal with your perinatal symptoms, perhaps you're a night worker and maybe working night and having that circadian rhythm being off may not be the best thing for your mental health. There is the Pregnancy Workers Fairness Act. Pregnancy Workers Fairness Act, and although there are states who try to challenge it, it is a law. And it allows, even without a doctor's note, that things that are considered to be reasonable requests, like having the right size of your uniform if your job wears uniform, having a chair that's ergonomic with some back support, having a leg rest, having changing your hours, coming in a little bit later because you're exhausted in the morning. Those are considered to be reasonable requests, and those are legal ways in which you can protect yourself. Okay, that's my end. I hope it's been helpful. I hope I gave enough tips that you can not only just have for yourself, but share with other people in your community, in your family, in your friendships. If you're seeing symptoms, maybe share the video with someone that you think may be having some of these symptoms. And keep in mind, again, these symptoms can happen at any point in the critical postpartum period, which is up to a year, right? So she may be fine the first couple of months, but a year later, or it's 8 months later, she may be having these symptoms. So always keep this in the back of the mind. I would say even up to 2 years, because I've had some women that had their symptoms for a good 2 years. So always keep childbirth in mind as a potential cause for a mom's mood disorder. And on that note.
Wow. Yes. I love it. I love it. Oh my God. Everything you said, I was sitting here like, yes, yes. And the reason why I was saying yes, so thank you so much. Oh my God, that was
My
amazing. You are
pleasure.
amazing. The reason why I was sitting here doing yes, sis, yes, because
I love it.
I went through postpartum myself, and everything
Hmm.
you mentioned, and everything you said, I went through. My job was. I'm not gonna put a job under the what do they call it? I'm not gonna put a job under right now, but I
Right,
had
right, right.
yes, that word. I mentioned to them that I had postpartum or just had a baby,
Hmm.
or I had jobs where I was pregnant at the time, and I had my daughter during the pandemic. And so at that time, there were
Hmm.
people coming into work that were sick, that were coughing, had high fevers, that were
Hmm.
testing
Hmm.
positive for
I'm sure.
for COVID, and they were
Hmm.
still allowing them to come to work. And I had moments where I needed to park in the front. Like I said, I'm not
Hmm.
putting the job under, but there were
Right, right.
moments that I had to park. I wanted to park in the front, but
Hmm.
because my shift was a later shift, I had to park
Hmm.
way down the street. But then I
Hmm.
realized there was pregnancy parking right in the front of the building, and so
Yes, ma'am.
I had
Yes,
to
ma'am.
fight for an earlier shift so that I can get there early enough to be able
Hmm.
to park in the front. And they were the security would put cones out for me. The people would
They're supposed
coworkers
to.
would say, "Jordan, let me know when you get here. I'll move my car."
Hmm.
They get there early in the morning. So everything you're saying, I'm like, okay, I knew I wasn't wrong for
No,
everything that I
not
was
at all.
going through. And even with one of my jobs, like I said, I'm not putting no job under. I'm not going to mention no
Uh-huh.
names.
We're not gonna throw them
I'm not
under the
going to mention
bus.
no
No, we're
names.
not.
But now I'm seeing why I had to go through all of those hardships, because now I'm able to be an advocate for other
I
women,
love it.
other moms who are going
Hmm.
through those things with the job situation, or going to work when I really didn't feel like going, and being there all day and wanting to leave, and letting them know like, hey, I don't want to be here at work. I want to go home, and da 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 da. I'm feeling
Yeah.
postpartum. I did all of that, all of it.
Wow.
And I had
Mhm.
moments where I actually went through a postpartum support international, and I
Uh-huh.
now I end up actually becoming a member. So now I'm able to talk to other women, other moms
Oh,
who are going through
wonderful.
those things. So yes, I joined their team, and I'm
I
also
love it.
their allies of
Mhm.
people of color. So I'm a part of both. I took some. I got a certificate from the Black Girls Mental Health Institute, and now
Mhm.
I'm
Mhm.
peer support specialist for maternity health. So it's
I
like,
love
no,
that.
yeah. So everything I went through, it's like a light bulb moment. It's like,
Mhm.
huh,
Mhm.
now I see why I had to go through all those things, because if I
Yes.
didn't, I wouldn't really know when I'm talking to people, they
Yes.
wouldn't know what I went through
Yes.
now, or I wouldn't be able to relate to them. And
Right.
so now that you were
Mhm.
saying all those things, I'm like, okay, it's like almost a breather for me, almost
Oh, I'm glad.
a weight off my shoulders, because it
I'm
was a lot
glad.
going through postpartum, and I
It
felt
is
like
a
no
lot.
one understood what I was
Mhm.
going through. No one understood at my job, or stuff like that, or if it was moments where I was wanted to be at home, I didn't want to go out, and stuff like
Mhm.
that. There was moments I wanted to step outside of my job, on my
Mhm.
lunch breaks or whatever, to get some fresh air, to get some
Yes.
sunlight, because I was doing I had got a therapist
Hmm.
And so she was telling me, go outside, get some fresh
Yes.
air. And I would get written up at my job.
Oh, they're not supposed
Yes.
to.
For being outside, I guess longer than my 10-minute break or
Hmm.
lunch
Hmm.
period and stuff like that. So no, everything you were saying, you were spot on. And like you said,
Oh, thank God.
the support from fathers
Hmm.
is also important. And that's
Hmm.
why I started my nonprofit to help the moms. And I also started the nonprofit to also help fathers because when they know
That's
what's going
great.
on, yes, when they know what's going on with us as moms, they can be supportive to us. And like you said, taking those breaks if he's, has to go to work at night or work in the morning,
Hmm.
maybe take those breaks, give her a break, give him a break, And then my other thing was asking dads, how are they doing? Because I've
Yes.
noticed when people have babies, they
Hmm.
tend to forget about mom. Not
Hmm.
all people, some family
Yeah.
members, they're like, oh, I just want to talk to the baby. That's it. I have my
Yes.
little moments
Yes.
like that too. I love my family, but
Yes.
I have my moments like
That
that
social media
too.
trend is very true. Yes.
Yes, when they would check on the baby, but I'm like, they're like, oh, hey, Jordan, where's the baby?
Hmm.
And I'm like,
Yes.
hello, how are
Right.
you doing? Thank you for
Right.
asking me how I'm doing. So I notice if people are not asking mothers how they're feeling and how they're doing, they're not
So
asking
true.
dads how they're feeling, how they're doing. And so
Yeah.
that's why it was so important for me to start my nonprofit and to open it up to also getting that support and that those resources for fathers too. So no,
I
everything you
love
said
that.
was
I
great. And I
love
did
that.
have a
You know,
question.
Jordan,
Yeah,
just to add on to what you shared there, and a point I didn't
yeah.
highlight, but I would like to since you brought it up, the fact that dads do experience perinatal symptoms, right?
I was
So
gonna ask you that too.
yes,
Yeah.
dads do
Wow.
experience perinatal depression,
Mm,
perinatal anxiety, and it's especially in our dads of color, it
yeah.
doesn't look typical, right? You're not going
Okay.
to see the typical symptoms. And so it's really important to have that communication so that he's aware that he too
Mm-hmm.
can experience it. A lot of our Black dads especially have traumatic histories, right? And
Yeah.
so
Mm-hmm.
having someone that may be snapping at them can be very
Mm,
triggering. And so
yeah.
it's really important to assess the couple that may be at risk even before the baby arrives, and that dads are
Mm,
aware that if you are seeing these symptoms, you may be experiencing postpartum depression also. So
wow.
it's important for them to know that as well. And a lot of
Yeah.
dads don't. We need to get that word particularly out.
Yes. That was going to actually be my question on my paper.
Uh-huh.
Did fathers, experience postpartum? You answered it. So that was one thing because I know a lot of dads that I talk to within my, organization.
Mm-hmm.
Um, reason why I'm giving them awareness, let them trying to raise awareness about postpartum because a lot of dads
Yes.
they tell me I don't even know what that is, or they'll just I
They
remember a
don't.
couple of them say I thought she was just tripping, like,
Mm-hmm.
and it's
Mm-hmm.
like
Mm-hmm.
no pay, and it's like no pay attention to the symptoms, pay attention to recognize the symptoms in
Yes.
her, not just dads but the whole family. Everyone
Mm-hmm.
could be like, oh, she's fine, or like you said,
Mm-hmm. Mm-hmm.
ask the family to help, or I
Right.
know for some moms it's hard to ask for help.
Mm-hmm.
I had little moments like that
Yeah.
too where they'll say, Jordan, just let me know when you need a break, and I'm like, okay, but then I don't ask for help, or I don't say, hey, you know what, I need a day to myself, and then but not feel bad for wanting a day or an hour or 2 hours to yourself. I know when I
Yeah.
would like you said with Cardi B with the whole set her saying that she wanted to take care of herself after having her
Mm-hmm.
child, which is
Yeah.
very important. If we don't take care of ourselves, we can't take care of anyone else.
Absolutely.
Yes,
Absolutely.
yes, most definitely.
Yeah,
Yeah.
and yeah, no, definitely prioritize you. It's that whole metaphor we use, or yeah, that whole metaphor we use where putting your oxygen mask on first
Yes.
also applies to the postpartum period. Right?
Mm-hmm.
Right,
Yes, most
Todd?
definitely. We got some
Putting
thumbs
that
up.
ox
We got some thumbs up
yes,
there.
putting that
Yes.
oxygen mask on first because and to your point, Jordan, as well, I didn't call it out as a risk factor because I think there's lots of it's a very complex issue, but that strong Black woman persona definitely permeates through our
Mm,
pregnancy experiences.
yeah.
And so for a lot of Black women, we haven't been welcome to ask for help. It's not only that we don't ask for help, but there is a expectation that
Yeah.
we should be able to handle things, right?
Yes.
And so that strong Black woman stereotype has been a detriment because of that. But
Yeah.
I would love to see Black women who are moms really tap into that soft life, right? We talk about
Hmm.
soft life as a general trend, but
Yeah.
we want to apply that soft life to the maternal experience as well, so that
Hmm.
Black women feel safe, right? That we're
Yeah.
not criticized, we're not talked down to. And there's some generational conversations we could probably have about that, right? Because
Yes.
this is a shift from our traditional culture. And so
Hmm.
sometimes we don't feel safe to even express that we want help. Like we want to ask for help, but we don't feel
Yeah.
like we have a safe cultural, whether it's our familial culture or our friendship culture, where we can ask for that help. So we want to make that change. And I'm glad that you're acknowledging that
Yeah.
and making that a part of your mission is to really change that and create safe spaces where Black women can ask for help.
Yes, most definitely. Most definitely. I think I had some another. Does anybody else have any
Sure.
questions they would like to ask the doctor?
Yeah, I was
You
gonna
can take
make
yourself off of
mention.
mute.
Yeah, I'm glad she mentioned about the nutrition because I was gonna say something about that a long time ago, but you, as you came down, you hit it, and I was like, there you go. And I was also thinking about the balanced nutrition
Uh-huh.
and the prenatal vitamins as well, but sometimes they may not still get everything they need. Yeah, but I was thinking about the nutrition as well and
Yes.
how you
Mm-hmm.
can balance it out and what are they to even help even with stress, like your blueberries,
Mm-hmm.
your kiwis, but then they
Okay,
have
come
to
on, Miss
make sure
Jordan.
they have to make sure there's no
Uh-huh.
allergies,
Right, right,
because
right. But get those antioxidants for because
ex-
you're healing. You're healing,
yes,
right?
exactly. So I thought
Mm-hmm.
about those fruit, more fruit and vegetables, of course,
Yes,
less meat, but you
yes.
need the protein, but
You
they
need the
need
pro,
more
especially if you're
fruit.
breastfeeding.
Yeah, yeah, they need more of the fruit and vegetables, a little less of the dairy, I believe.
Mm-hmm.
Is and but like that balance is
Mm-hmm.
so important
It
that
is.
everything's not fried, is more baked and
Right.
broiled or just, fruit and vegetables.
Right. That's why we wanted that village to bring over some cooked food.
Absolutely. Yes.
She
Yes.
may not be able to cook, she may not be able to go to groceries, right? But you
Right.
can, right? You can
Yes.
be a part of her
Yes.
village. That's how you help out a mom is go grocery shopping for her, meal
Hmm.
prep for her, so that during
I
the
was
week.
That's the word, meal. Yeah, I was gonna say pre-prep, but you same thing. Yeah, pre-prep.
Mhm.
Even for herself, pre-prep things where you know, fruit and berries is in a Ziploc, or some frozen spinach is in the freezer, and different foods like that. But I know that's very important to make sure, like you said, that pre-prep, because you can spend hours in the kitchen and your health may not permit that, and somebody
Mhm.
may not be around to be able to assist you at that time.
You know what, Jordan, you brought up a good point, which is what if you don't have that village, right? Like, what if you
Mm,
don't have that village that can show up for you? And
yes,
unfortunately, there are some moms who don't, right? One of the things you can do is when you have that energy, especially when you're off from work in that last month before you give birth, as most women should be able to be off from work,
yes,
at least in
yes.
California, you can from 36 weeks.
Mm-hmm.
Prep your food, make a bunch of dinners and
Yep,
throw them in the freezer so that that first 2 weeks you already have your cooked food. It's your own cooking, so you don't like it. Put
absolutely.
those meals in the freezer, right?
Mm,
And that first 2 weeks, you have cooked meals that are ready, just like you freeze the breast milk so that you have a storage available. Do the same thing with your
yes.
meals in the last couple of weeks before you prepare for to give birth, to bring life into the world. Prep your meals. and
Hmm.
put them in the freezer.
Absolutely. So thank you.
Thank you.
That was
That was a good comment. Yeah, nutrition is needs to be emphasized.
Oh yeah, most definitely. I had a question. Let's see. I wrote it on my paper. Let me see. Postpartum. Do you think postpartum is this has to do with the baby or maybe the situation that that mom is in? Like
That's a
postpartum depression coming about. Is it you
That's a
think it
good question.
yeah.
Yeah. It's a combination, right? There are some women who, for example, women who have babies that are NICU, unexpected birth, like preterm birth, they're more likely to experience postpartum symptoms, um, traumatic deliveries, that emergency section, right? You're in labor, everything's going great, and then all of a sudden that heart rate drops and before you know it, someone's rushing you to the OR. You barely have a minute to even process. So those types of experiences can be triggering. Similarly, a baby that's colicky. And a lot of parents don't want to express that they're frustrated with a colicky baby. It's okay to say you're frustrated with a colicky baby, right? Like it doesn't reflect on your love for your child. But you can say colic is hard. It is really hard to deal with a baby that has colic. And so it's been shown that parents who have fussy babies or colicky babies are also more likely to deal with postpartum symptoms. But postpartum symptoms is a really complex disorder that has to do with hormonal changes, biochemical changes, the exhaustion of rearing a child. Because when you think about our sleep pattern. So a lot of the way the body balances itself, the way our sugars are regulated, our blood pressures are controlled, has to do with when we sleep, right? The majority of our health is taken care of. Cancer cells get taken out of the body, recognized and removed when we are resting, when we're sleeping. And what does the postpartum period do? It takes that away. Did you guys know that the type of pattern that parents sleep during the postpartum period is the type of pattern they sometimes use for psychological torture? And so think about how that just shows you how much that dysfunctional sleep has on the body and has on the mind. And that's why maximizing rest, even if you don't fall asleep, just laying on the bed and allowing that body to recover is so important. But I say all of that to say the experience going through that newborn phase is so taxing. And even if you had a vaginal delivery, C-section, you still have this huge area that has to heal. That uterus has to contract back down. That placenta that used to be attached to your womb has left a unhealed area that has to heal, and it requires energy, it requires resources. And so it's a multitude of things that lead to why a woman may experience postpartum depression. We know that there is a genetic component, right? So those who have had depression in their families are more likely to have perinatal symptoms as well. So there are a number of factors that really play into it.
Wow. Whew, this is some great information. Thank you so much.
So that's to say, what our moms do is amazing.
Yes, yes,
It's
yes,
absolutely
yes.
amazing.
I agree. I totally agree. I had to, I remember I could not get any sleep and I would have to, I bought blackout curtains because I just could not fall asleep at all whatsoever. I just be up. And I'm like, why can't I? And then you go, I have to go to work. I take the baby to daycare. I was like, oh my God, I can't sleep.
Right. And that's a symptom
Yeah,
of depression, right?
yeah.
Insomnia is a very common symptom of depression.
Yes, most definitely. Yes, most definitely. Okay, we have Claire on the line. Did you want to say
Hi,
anything?
Claire.
Hi.
Hi, thank you,
Hi.
doctor, and everyone a part of the. I learned so much in this like short 15 minutes I was on, so that was
Hello.
really good. Yeah, I'm a nurse, and I'm actually going to be graduating NP school in about 3 months. Yeah,
Congratulations.
thank you.
Woo!
Yeah,
That
awesome.
is
Well, yeah,
fantastic.
thank you so much for having me on, or
Yeah,
just
thank you.
letting me join in. I'm not a mom yet. That's one of my desires, but now I have a heads up to prepare
Yes, you
some
do.
dinners prior. And then I do have a
Yeah,
community, my church family, my that village that
Wonderful.
you guys were talking about. So
yeah.
glory to God. I was wondering if I interviewed Jordan, but if any of you would be interested in being interviewed for my Purple Princess series, um, basically I just ask people with different experience, different backgrounds to hear OBGYN's
Yes.
experience, whether
Uh-huh.
they're pro-life, pro-choice, or somewhere in between, and just get their thoughts on like a video regarding abortion. But I would love to have you on if you're interested. The chat.
That's
If
definitely
you
an issue that comes
would
up
just
often now.
yes. So I think it's important that we talk about it, have dialogue, and really
Yes.
just talk about it. I think that that's important, and that especially it affects women
Mm-hmm.
especially women of color. But I
Yes.
do want to just hear your thoughts on it, and I'll just put my email in the chat, and if you want, we could set up a Zoom, just like
Yes.
we did with Jordan,
Yes. You
if
you
that's
can do
okay.
that. Yes, of course.
Okay,
Thank
thank
you,
you.
Claire, so much
Thank
for
you so
coming
much.
on. I'm so
Oh
Thanks
my
for
excited.
gosh, this was a
thanks for coming
blessing.
on.
Yes,
Oh, this was
most
so
And
good.
definitely.
congratulations. What area of MP you want to work in?
So, family nurse practitioner, I want to do orthosurgical NP, but wherever the job is, I'm open. I just had my gyne-onc rotation, so did a
Oh,
lot of pap
okay.
smears. So,
Yes, yes.
but yeah, I definitely, value life from womb to tomb. That's why I chose family.
Yes,
Woo!
you should be able to say where you want to be and trust that the door will open.
Yes,
Amen.
yes. There's room.
Amen.
There's room at the table if it's
There's
meant for me.
room.
So,
There's room.
yes.
There is
Yeah.
room.
We got doctors and nurses and all kinds. Oh, yes.
I
Oh,
love
yes.
it. I
Thank
love it.
you.
Thank you for bringing us all together.
I know.
Yes,
Thank
most
you, Jordan.
definitely.
This was a blessing.
Oh,
Hmm
you guys are so
hmm
sweet. Thank you. Look, Claire, I'm gonna have you as a guest speaker one day too. So get
Oh
I
my
ready.
was about
goodness.
to
I would,
say.
oh, girl, would
So
love that.
get
I would
ready,
love
girl.
that. Yeah. All right. I guess I'll get ready. How long do you
No.
need me to speak for? No,
As long as
you
you want.
know, it's like,
Get
okay.
ready, get ready, get ready.
Yes,
I'm a
most
person of very few words. I will say that, but I
okay.
can
It's
come up
all
with
good. You
something.
can write it down like I have notes.
Oh, okay. All right. As long as I can read my notes, I'm good.
Got it. Got it. Awesome.
I love it.
All right, Miss Donna, did you have something you want to say? She also went to nursing. Actually, she is my mom, so Donna's my mom. Do you have any pointers you would
Great.
like to say? I know you did nursing and home health, and she's worked with special needs children and all
Oh,
that. So, do
wow.
you have anything you'd like to say since we got all these doctors and nurses on the line?
Right, right.
Yes.
Uh, no, well, health is an issue, but health is something that's very important that we are seeing to it that it is being taken care of in every aspect of life. And I'm so grateful for the doctor being here, for the nurse being here, and for Jordan and and viewers, because
Yes.
it does, it can be 4 or 5 people, but it's going to be on YouTube, and so other viewers are
Yeah.
literally going to be able to view and take heed to some of the information that was given. And so no, I'm just grateful to be among these beautiful ladies right here, and I'm grateful to be a mom and a grandma. um
Uh-huh.
and then my mom and my dad, actually, but my parents are still living. Actually, they're in their 90s, and they're
What?
still getting around. What Usually they're usually on the Zoom.
Yeah.
They probably
Uh-huh.
had a day of doing whatever they wanted to do
I
today.
know that's right.
Yeah, I hung up with
We'll
them.
send them the replay.
Exactly,
I'll call
but
my grandma later and tell her what we talked about.
right,
I love
exactly.
it.
But so
Wow.
no, it's just grateful to see, different health um issues heal up,
Yeah.
and are
Mm,
people overcoming
Yeah.
different issues in their health, um in the process of healing process,
right.
Because
including myself. Start with me first, but
Mhm.
it's a blessing, to be faith based, and still, but just help the community with
Mhm.
information, that is out there, that just needs to be
Yes.
said and done and
yeah.
learned, and just received.
Right,
And so
right,
I'm just
right.
grateful. I'm just grateful. Did you do your scripture, Jordan?
I did not, Mom, but I was gonna do that next.
Oh,
Oh,
okay.
I
No,
love
no.
it. She said,
What?
delete,
What? No, no. I wasn't
delete,
sure if I
delete
missed it,
invite
and
Jesus.
it was, so it's gonna be dealing with what we're talking about today, which is
Yes. So
awesome.
thank you,
So
Mom.
I
I
thought I
do
missed
have a
it.
scripture.
I
It
love it.
is
I
from
love it.
Exodus 2, 1 through 10. I'm not going to read the whole scripture, but I'll just
Hmm.
give you a paraphrase. It's talking about, it's the story of Moses when he was in a basket.
Hmm.
So basically, it just says the story of a new baby being taken care of, even when there was danger around. God still protected him. And so Moses was placed in a basket as a baby and in the Nile River, and he was in danger since birth. And his mother, put him in a basket, put him in the Nile
Hmm.
River,
Hmm.
and he was raised by an Egyptian queen, Pharaoh's daughter, and his big sister secretly watched over him and protected him. And she wanted, I guess she went to the queen to offer to find, a Hebrew woman to nurse the child, not knowing that the person that ended up nursing the baby was actually the mom.
Hmm.
So
Hmm.
that is a very significant story. So when you guys ever get a chance, go to Exodus 2, 1 through 10, and it's the story of Moses and how he was born. And I think Pharaoh wanted to do something to all the baby boys or something like that. So that's why the
Hmm.
mom felt comfortable to put the baby in the basket to, send them off somewhere else to be safe, basically. And so it even
Hmm.
shows in the Bible how much as a mom, as a woman, we want to protect our child or protect our family. And so it goes back as far as the Bible. And to
Yes.
this day, we're still acting, like that of wanting to take care of our babies, take care of our family. And I was telling my mom earlier this morning, I said, it really doesn't matter if a person is a mom or not a mom. There's people out there who are fosters moms. There's people
Hmm.
who are there's women that are sisters, and they just take really good care of their little siblings or aunties, grandparents. There's a lot of
Hmm.
friends and family who raised by their grandparents. And
Yeah.
so just being a mom, just having a baby, and being a mom doesn't always have to be you actually gave birth to that child. Being a
Hmm.
mom to
Hmm.
me could be any woman who's caring for a child or a kid or a baby and stuff like that. So that's why I wanted to that scripture was so important. And like I said, my mom and I had this conversation this morning.
Hmm.
So thank you, Mother, for reminding me
I love it.
about
Love
that.
it.
Yes, I have
Yes.
my notes.
Yes.
I have my notes. So yes. So I guess I'll just give a little pointers and stuff. So thank you guys all for coming on. I'll just give you guys a little rundown about what we're doing in my nonprofit. Our core values are love, support, compassion, and encouragement. And that's what this organization and myself we stand on, and integrity. And integrity. So yes, I want to thank you guys all for coming on to our community workshop. It has been a true blessing for all the ladies and all the women that are on tonight, whether it be doctors, mothers, nurses, founders of nonprofits, all that good stuff. It's
Hmm.
just a
Hmm.
true blessing that as women, regardless if we have a child or not, that we can come together and just support one another. And that's just who I am. You can ask my mom, you can ask anyone that knows me. I love to encourage people. I love to support others and other women. And like I said, that we have the program for the fathers. I love to support them too and render resources for them as fathers, as men, because they need help and support just as well as us women, as moms need it too. And so, yes, if anybody have any questions for the nurse or the doctor, you guys can, ask, or if you're all out of questions, I will give, I guess, the last bits of. Hold on, I'm reading my notes, y'all. So give me 1 second, y'all.
Hmm. Hmm.
Okay. Okay. So yes, I did mention that I am a member of the LA South Chamber, and I'm also a member of the Postpartum International PSI group. And like I said, I actually utilized them when I was going through postpartum years ago. And then now that I have my own nonprofit and, I'm trying to help moms and women that are going through it, postpartum and just prenatal wellness and all that, mental health. I decided to join them because they helped me. I joined some of their groups and they were very helpful. And there was women from all over the world. I think it was people from Africa that were on there. There were people from California, Texas, just everywhere. And I always feel that when we have that support as moms, as women, we can do so much better and heal up quicker and or just give stories and testimonies to one another. Because as I'm talking to people and family members about postpartum and trying to raise awareness about it, I'm finding out there's a lot of women that are going through postpartum now that either went through it or about to go through it or they never had it at all. And so, like I said, it doesn't matter. I'm here. I'm trying to just open some doors up to these conversations because it's important to at least know what postpartum is, or at least be aware of the symptoms and be aware of what to look out for, and then what our family members and spouses are supposed to look out for when they see it in us or family members or whoever. I did get I got my certificate from the Black Girls Maternity Mental Health Training. So I am a maternity, it's a long name. So it's a maternity mental health peer support specialist. So yes, I got my certificate in that. And right now, and I actually just got a scholarship from PSI, Postpartum Support International, to get my prenatal mental health certification. So I am working towards that. They gave me a scholarship and a 2-year membership. So yes, I'm so excited. I'm just like, okay, Lord, here we go. I'm back in school, so I'm trying to get that certification so that I can be of help to other moms and be more clinical about it. Like right now, I speak from my own experience. And now I want to start speaking from like clinical parts of what postpartum is and prenatal care and, prenatal mental wellness and all that. So I'm excited for that journey. I heard that test is really hard. It's like 100 and something questions, but I feel like I can do it. I got this. I'm trusting God, and I know that He knows this is what is important to me. And thank you, y'all. And He knows that I have a reason on why I'm trying to get certified or get these credentials under me and all that stuff. So yes, I am so excited about that journey. So let's see if you guys want to put your information in the chat. Thank you. If you want to put your information in the chat, that will be great. Let's see. Just a quick little 5-minute little spill. I do have a joke book that I do every time. The joke is, who is the greatest babysitter mentioned in the Bible? You guys could take yourself off of mute. I have a Christian Bible joke book. Who is the greatest babysitter mentioned in the Bible?
Jonah.
That's funny.
The
greatest babysitter
mentioned in the Bible. Yes.
Wow.
Joke.
Laughter is medicine, so that's why I do these jokes.
Yeah, no, I love laughter. I love laughter. I'm trying to see where they're going with this one, though.
I know, right?
Was it Mary? Because she's the one that stayed at the tomb, so she babysat Jesus.
Come on, Claire, help us out.
Come on, Claire.
Come on, Doctor.
Think, who else babysat?
Keep thinking.
Wait. I think. Can I try?
Yeah.
I think God, because Israelites are the biggest crybabies.
Oh Lord. No,
no.
So the answer is David. He rocked Goliath's to a very deep sleep.
Oh, that's
Oh my
funny.
gosh.
Oh.
Okay. That's a good one. Okay.
That is
David
very
and
funny.
I'm
Goliath.
sorry, y'all.
I actually would have thought that they would have said was Saul, because he played for Saul and rocked Saul to sleep. So
That's a
I
good one
I
guess
know,
too.
or somebody in the Bible who played the you know, not the guitar, but the harp and all that stuff, like
yes,
lullaby type music or
that was
something.
his
I would have thought
David.
ministry
that.
with Saul before
That
he
was
took
David.
over. So I mean, yes, I guess he won.
He rocked him to sleep.
He rocked
No.
him to sleep, a deep
Yes.
sleep.
Yes, most definitely, yes. So I
Okay,
don't
that
know
was a
why.
good one.
That's funny. That's
Thank
funny.
you. I
He
don't know why I
rocked
do
him to
these. If you
sleep.
got,
Y'all are
once you
funny.
guys really get to know me, you'll realize that I am so goofy. I just
I
don't
love
know.
that
It could
one.
be
I love that
serious
one.
moments, and I'm just like cracking jokes. I remember I was telling my mom a long time ago. I was in the hospital for something like long time ago. I don't know what it was for. But I was like, I woke up. I think, I think it had to do with my like wisdom teeth or something with my teeth or something. And you put you to sleep when you're young. You because you don't want to be awake or something. I think I woke up talk about I want a cheeseburger or something. And I'm kind of drowsy and I'm just like, I don't want a cheeseburger. Like I've always been this like goofy jokester like type person. I used to get in trouble for cracking jokes in class. So now
It's wonderful. It's a
people
joyous
pay me for my
spirit.
jokes. I'm
It's
just kidding.
wonderful. It's a joyous
Yes,
spirit.
yes,
It's wonderful.
Mhm.
Yes,
Most
yes.
I want you to
definitely.
put
So
that. I
yes.
want you to put
So
that up. Can you put that up? I don't know if you're going to put that up underneath the video as a question, but I'm curious
okay.
to see what people are going to say.
Yes, I will definitely put that
Oh yeah,
on there
that's a
just
good
to
one.
see what they have to say. Yes, because
Yeah.
I feel like that is a good one.
Do you have another one,
So
Jordan?
I
You
have a few. I got a couple of announcements.
Oh, okay.
Yes,
Oh,
but thank
you
you. Thank you. So we do have a campaign going on called the We Care Love Basket.
Oh yeah.
And it is a basket full of women essentials. And so the reason why I create these baskets were to let women know that they are cared for, they are loved, that they are seen. And so when I create these baskets, we have people that can nominate these women to get these baskets. So sometimes, well, a few, we've given out maybe like 12. We had husbands, we had goddads, we had neighbors, aunties, co-workers, family members who would nominate a woman or a mom. It didn't matter if they were a mom, they could be just a woman that has gone through some tough times in their lives. And so people nominate them and then they reach out to me, they email me, and then we pop up at their house or pop up wherever the person who nominate them send us the information, say, hey, we did one, and it was at Doolin's restaurant and off of Crenshaw, and so yeah, the person send us a message, say, hey, I want to nominate this mom, and yada yada yada. And then we're like, okay, cool. So we had our FreeMe t-shirts on and we popped up, and she was like, who are you? She didn't even know who I was, which was totally fine. But I just let her know, like, hey, this basket you were nominated for this basket, you're a mom, you're a woman, and somebody sees what you're going through and they want to let you know that, hey, they love you, we love you, this nonprofit loved you. And I've been trying to get all these baskets out and just support moms and stuff like that. And my mission is to make baskets and more maybe boxes or something. That is my mission, so I'm working on that. So if you know anybody who wants to donate women essential items or donate to my nonprofit, I could put that in, send it to you guys. But that will be very helpful. And then eventually I want to make baskets and boxes for men, like a We Care Love basket for a father or for a man, and then maybe a We Care Love basket or box for a family, like so families can come together and just enjoy each other without our phones, without the TV, and just enjoy each other. I do want to mention that I am an author. I have a children's book called How Miss Cheetah Got Her Spots. It is on Amazon. All my books are on Amazon. I created another book called The Poetry of Love and Everything in Between. So it's a book of poems, book of poetry. So I am a poet too. Okay. And then I also made the Blossom Devotional Journal, which is a journal where you could put affirmations. You could put your daily, monthly goals, prayer requests, just anything you would like to put. It's a journal, so you can just keep up with it every day and write, your ideas, get them out on paper. I'm very a stickler for people getting their ideas out of their head and onto paper, because I was telling people some of the stuff I've written in my journals have came to pass, and the Lord, he helped me manifest it and the whatever. And a lot of stuff has come to pass, and it's because I wrote it down. I said, one day I want this. One day I want to start a nonprofit. One day I want to be best author and the da 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 da. And even though some of the stuff may not have happened just yet, or maybe I'm in that waiting period, but I know it's coming. I know it's coming. And today I was letting them know. Today I went to my first Black Writers Tour. They had an expo today, and I actually rushed back into here so that I can start here and be with you guys tonight. And so it was a true blessing. I met a lot of authors and other organizations, and it was just awesome being an author and being able to be amongst other writers and authors and stuff. So it was very engaging, very insightful, and just encouraging to keep writing and keep going, and encourage anybody else, if you want to write a book, just do it. Just do it. Just do it. We would like to have some fundraisers, so we're working on that. Fashion shows and fitness classes, poetry slams, and basketball tournaments. This is all the fundraisers that are going to be coming soon, so stay tuned. Toy drives and clothes giveaways and all that. We do have an event, a Mother's Day event in May 23rd. So if you guys want to come to that, spread the word, all that good stuff. It's going to be just a day to recognize moms and to support moms and just show them, to celebrate them, basically. Like I said, I'm a mom, and even if you're not a mom, you can still come. You can still come support us, and we'll support you. And just as women in general, we are partner up with, like I said, LA Care, LA South Chamber, the WIC program. I'm partner up with LA, like I said, Care Community Community Resource Center. I've done some, they had some mommy and me classes, and then they had some, I think it's called coffee and something. I forgot. It's like a little thing they do after the mommy and me class. So I've done some stuff with them as a vendor, resource table. I've partnered up with Black Girls Vitamin. And right now I'm trying to partner up with a therapist or like counselings to offer those services for some of these moms and some of these families. So let's see. I am also, I forgot to say, I'm also a part of NCNW, which is the National, I forgot how to say it. Anyway, NCNW. So that's what we're going to stick with. So yes, I'm a part of that also. So let's see. So I guess if we don't have anything else to say, Mother, do you have something you would like to say? Because I feel like you have something to say, which is fine.
Did you the 1,000 grandmothers?
Yes,
100 or 1,000?
It's 1,000. Yes, I am also connected with when 1,000 grandmas pray, and the reason why I wanted to connect with them and partner up with them is because I feel like there's so much wisdom when it comes to grandparents. There's just so much wisdom, and it just, yeah. So that's the reason why I connected with them. And I know it's a lot of people who may not have their grandparents right now. And so being a part of their organization and them being supportive to our moms and to the women of our groups, we're able to get some insight on being a mom, being a woman. There are things that they went through that we're going through now, and maybe they're able to drop some wisdom into our spirits, into our hearts, and be supportive in that aspect of being a mom, being a woman. So yeah. So is there anything anyone would like to say? The floor is open.
One more thing.
Yes.
You mentioned your 5-year-old's program.
Yes. So my daughter, I am a mom. I have a 5-year-old daughter.
I just
Mom, do you have a list over there? I'm scared.
you're you do a lot, so I just have to kind of help you out. That's all right. Remind.
Yes, well, thank you. You're so right. I do a lot. Yes, I do, and I'm proud of it. So yes, I have a 5-year-old daughter. And in my nonprofit, there was a moment she noticed there were some people on the streets, and there were some young people on the streets with their parents, and so she had a moment where she's like, "Mommy, I want to help the mommies and the babies that are on the streets." And so we created these baskets called Cotton Candy Love. It's her program underneath my nonprofit. And so basically, there's essential bags, but they're for kids. They're toys, books. She picked it all out. There's snacks, water bottles, and just essential stuff, toothbrushes and stuff like that. That's for the kids that she is seeing that are on living on the street with their parents. So yes. So thank you
Yay!
so much for that.
Good. Hi, sir.
So yes. So thank you so much for reminding me. Is there anything else anyone would like to say? Doctor, do you have anything last minute encouraging words?
I just want to say congratulations on all the things that you're doing. I love tapping into and bridging the gap, the generational gap. So I love that you're doing that with the grandmothers. They've been through harder times than we have seen, right? And so
Yes.
I know they have some wisdom to share. So I love that. I
Yeah.
love the fact that you're modeling so well that your daughter was inspired to start
Yeah.
her own project or mission. So I think that's great. I think that's
Thank
absolutely
you.
great. And
Thank you.
congratulations on everything.
Thank you so much. I appreciate it. Thank you. And thank you so much for coming on. I appreciate you too. And we met at She Builds LA in Inglewood, and it was amazing. It was an empowerment women's event, and that's where I met Doctor. And it was just we met so many great people, and I'm just so glad we were able to connect, and for her to be a guest speaker tonight. And I appreciate you and all that you're doing. And you guys make sure you follow her on Instagram and YouTube, and I will of course tag her in on everything. Yes, 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 most definitely. Claire, did you have anything you want to say before we head out?
No, thank you. I really appreciate it. I have to go, but yeah, this was a blessing. I'm so glad I popped in.
No problem. Thank you so much for coming on. We appreciate you too, girl.
Oh, thanks, girl. All right, I'll be messaging you, Dr. Moore, regarding the Pro Life Princess series if you're available for that. All right, take care, y'all.
Bye.
Bye.
Bye. See you later.
See ya.
See ya. All right. Well, I'm going to pray us out and we'll close it on that, y'all. All right. So thank you, Lord, for tonight. We thank you, Lord, for our guest speaker. We thank you, Lord, for our guest that's came on tonight. We thank you for just empowering women, empowering moms to just take care of ourselves and take care of our families. And to always put you first, Lord. We thank you for the insight. We thank you for the resources. We thank you for the people who advocate for us. And thank you, Lord, for allowing us to advocate for ourselves, also as moms and as women, as fathers, as parents, as doctors, as nurses, and supportive family. We thank you for tonight. We thank you for just for blessing us every day. And we thank you and we praise you, give you all the honor and glory. In Jesus' name, amen. Yay. All right, y'all. So I will see y'all, talk to y'all later, and have a good night. Bye. Bye bye.